Standing Committee of Petroleum and Natural Gas and Consultative Committee on Power, New and Renewable Energy. He completed his MBBS course from Dr. Babasaheb Ambedkar Marathwada University, Aurangabad in 1977. Thereafter, he completed his post-graduation degree, that is MS General Surgery, from same university in 1981. Post that, he got himself enrolled in Mumbai University to pursue MCH Pediatric Surgery and FCPS General Surgery from CPS College, Mumbai. He is the first pediatric surgeon and the highest qualified one from the Marathwada region of Maharashtra. Dr. Bhagwat Karad sir started as a medical practitioner in 1981 at Khedkar Hospital. Later, he started his own hospital, that is Karad Hospital in Nutan Colony of Kranti Chowk area in Aurangabad in 1990. He is the most qualified member of the Serving Union Cabinet and has been medical practitioner for 4 decades. His qualifications and achievements are endless. And now I would like to request Dr. Bhagwat Karad sir to say a few words for today's Febcon 2022 National Conference, as we all are eager to get some guidance from you. Over to you, sir.
Now, inauguration of National Ayurvedic Conference. The dignitaries on the dais, dignitaries of the dais, and all doctors and the peoples who love Ayurveda from all over country. First of all, I thanks for inviting me for such a nice conference which will deal with Ayurveda. The Ayurveda is a science which is very important for us because it is the only science started in India long back. It is proud moment to address a gathering of almost 1500 plus doctors. And although I am an allopathic doctor, as already I said, it is a pride for the Indian culture and Indian society for the Ayurveda. Even we doctors in all faculties, we know the Shishruta, who was an Ayurvedic surgeon. And it is very encouraging to note that the almost 1500 plus doctors all over India are participating in this webinar. Though Ayurveda has principles and systems which have not changed over last 5,000 years, and the same principles hold true in today's era as well. This is the uniqueness about all the Indian sciences. There can be latest ways of implementation of the same principles because of the advancement of the technology. Staying in touch with the recent updates and technology is a great initiative, and every clinician or academician must take it on priority. Such events are a good means of knowledge exchange and technology transfer. It is a consequent effort of Nanal family successfully organizing national level seminars for propagating the authentic knowledge of Ayurveda to students and practicing doctors. 2022 is their 25th year seminar. This seminar is almost 50,000 students and participants across the country have benefited from such seminars. All medicinal practitioners follow one fundamental objective to cure the disease and to reduce the sufferings and pains. Ayurveda is also a similar science, and which is an ancient science. The Ayurveda is also, there is no exception to this objective. Ayurveda is the divine way of life and is medical system which emphasized on the motto, prevention is better than the cure. Ayurveda is the most used health care system in the country, except in urban areas. Yet, in the recent time, Ayurveda is being accorded its due, but too gradually. Vaidya Nanal family is a pride of our country and abroad, and their contribution to Ayurveda domains over past 100 years is remarkable. The journey started with late Purushottam Shastri Nanal, who started in 1950 with his clinic work, and he truly institutionalized Ayurveda in early 1900. But starting Tilak Ayurvedic Mahavidyalaya, Ayurveda Prashala, and Seth Tarachand Ramnath Hospital, his work was carried further by their descendants. Vaidya Vilas Nanal took a lot of efforts and did lot of research work on the revival of cardiac disorders. Thalassemia in association with the Jan Kalyan Blood Bank. Nanal Trust worked successfully in HIV patients and results were important. Ayurveda is also important in the tribal regions of the Maharashtra. They conducted training camps for whole practitioners and created manuals for their formal training and lending them. Expand hand with this. It is a privilege for me to officially announce their upcoming intentional event, Augustine 22. It is important in Goa. Now, just although I am a medical practitioner, I know that some Ayurvedic medicines are important. Of kidney stone, then the system tablet which we are using, it was from the Ayurveda. Similarly, in the cases of the jaundice or the liver diseases, there is no liver specifically medicine for the liver diseases, but we allopathic experts were prescribing the Liv 52 tablet. It is from the Ayurveda. So Ayurveda is a very important, and recently on this occasion, I congratulate Honorable Prime Minister Narendra Modi ji, who has given very much importance to the Ayurveda and the all ancient medical sciences. He has also decided to start 11 institutes in all over the India, and it will be a parallel to the All India Institute of Medical Sciences, which are started recently in different parts of the states in our country. So, and not only that, there is a separate department. It is an Ayush department started by Honorable PM and the concerned minister, who now is Mr. Sonowal, who was a Chief Minister of the Assam. I am sure that with the efforts from the Honorable Prime Minister and the central government, the Ayurveda will become famous all over the world, and it will compared to allopathy, it is a less price to the patient, less expenses will be accorded in the treatment of the patients. So, recently, some Ayurvedic colleges are going to start all over the country. That is, government is going to start, and not only that, the government has decided to give the jobs to the Ayurvedic doctors also, in particularly in the rural health care, in National Rural Health Missions. So on this occasion, I appreciate the efforts taken by the Vaidya Nanal family, and I'm sure that with the such efforts from the Nanal, definitely this outcomes which will come from this seminar will be very important. I congratulate Nanal family for such a nice program. They are conducted all the time since number of years. Anyway, I thanks again for inviting me and declare this webinar or seminar is inaugurated. And from my side, I give best wishes to the Nanal family, organizers, and all doctors who are attending these webinar virtually. Thank you very much. Dhanyavad.
Thank you so much, sir. We are very happy that today you have given your valuable time for us. As we all know that you are working for 4 decades as a medical practitioner in Aurangabad area. And we are so lucky that the importance you have told about Ayurveda, and also that in future our government is doing a lot for our Ayurveda student also, and for every practitioner who is doing Ayurveda practice. So thank you very much, sir, for your valuable time. We are lucky to have your presence here. We hope you will bless us with your guidance in future as well. Thank you once again, sir. A big thank you. Thank you so much.